When dealing drugs by prescribing medication as a physician, it is always a good idea to know what is the risk, where does it fall in the risk, so that you can be appropriately paid relative to evaluation and management. In today's video, I'm going to answer a question or comment, and also comments by a couple of people in the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. Evaluation and management has been around, the new guidelines have been around for over a year now, and yet there's still confusion, despite the innumerable webinars and seminars and presentations that have been done, and also things that I have put out on YouTube and also in this Thriving Urology Practice Facebook group. There's still confusion, but that's okay. That's why we're here, to help each other out, right? And for those of you who don't know me, my name is John Lin. I'm a urologist here in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group. All right, let's get into it. The question came from Ernie, who asked, does a prescription refill, for instance, antimuscarinic refill, fall under the category of prescription drug management under the risk coding block in medical decision-making? Hope I phrased that correctly. Thanks. There were a couple of comments, and also somebody else asked follow-up question. Ellen mentioned, what about a whole conversation offering antispasmodic and the patient doesn't want it? Reasonable, or stopping a medication for side effects, or because you see that they are doing self-catheterization, but they were kept on an alpha blocker? All great questions regarding medical decision-making. And let's go back to the very, very basics. Since 2021, evaluation and management is now billed based on either time or medical decision-making. And I have tried to encourage everyone to bill mostly by medical decision-making, because that is typically what we do. And also, it is a much more efficient way to see patients and to document. As they say, trading time for money is an inefficient way to be productive. And I'll leave it at that. Most of how we see patients is you're making a medical decision, you're coming up with an assessment, and based on that assessment, you're coming up with treatment options, and you're offering and actually implementing those treatment options. If you are billing based on medical decision-making, many of you know that you now need 3 elements in medical decision-making, and you need 2 out of the 3. However you come up with a code level, you need 2 out of the 3 elements under consideration to determine a code level. Now, this is based on medical decision-making, not time-based billing. So when you're billing based on medical decision-making, there are 3 elements that you need to consider. That's problem, data, and risk. We are specifically talking about one of these elements in risk. And within risk, you have minimal, low, medium, and high, corresponding to 2, 3, 4, and 5. And that is the level in risk alone. It is not the overall E&M level that we're talking about. We are simply talking about the risk level. Risk, one element, not the entire encounter, not the entire E&M level. We're just looking at one element. So hopefully that is clear. Within risk, there's something called there's something called prescription drug management within medical decision-making. So what is prescription drug management? That is the crux of the question. And Ernie asked, does a prescription refill constitute a moderate risk? So number one, it is under the category of risk, and also at what level? It is moderate risk. So what exactly is prescription drug management? Don't take my word for it. Let's check out what first Coast, which is a Medicare administrative contractor for Florida, Puerto Rico, and the Virgin Islands. One of the MACs, okay? Their definition in a E&M frequently asked question states, what constitutes prescription drug management? Question, during an E&M visit, what constitutes prescription drug management? Answer, prescription drug management is based on, and the highlight is mine, documented evidence that the provider has evaluated the patient's medications as part of a service. This may be a prescription being written or discontinued, or a decision to maintain a current medication or dosage. And here's the important part. Note, simply listing current medications is not considered prescription drug management. And I repeat, simply listing current medications is not considered prescription drug management. So that is the difficult part of being compliant, if you will. It requires not just your simple, quick thinking, looking at the medications that the patient's on, looking at the patient, considering all the problems that he or she is facing, and then coming up with a prescription and then electronically sending it. It requires more than that. It requires, and I will show you again, documented evidence that the provider has evaluated the patient's medications as part of a service. Documented evidence. And I hate to say it, it requires that you not just celebrate it, not just think about it, but you have to write it down, somehow get it on paper or get it in your electronic health records. Simply listing the medication is not prescription drug management, and you do not get to count that element of risk as moderate if you simply listed a medication without somehow talking about the medication. And so what is talking about the medication? What does that mean? It means you documented, hey, the medication, the anticholinergic for Ernie, who's talking about antimuscarinic, say oxybutynin. You would document oxybutynin or antimuscarinic medication working well for the patient without any significant reported side effects. Will continue medication. What I just said is considered prescription drug management. That is documented evidence that you thought about the medication, thought about the side effects, whether or not it's working, and you decided to continue medication. You can also mention patient on antimuscarinic, no evidence of undiagnosed and untreated narrow angle glaucoma, no significant xerostomia, no heat prostration, no constipation, no dizziness, and patient is not of advanced age, will continue medication. That also counts as prescription drug management. It is not just refilling the medication without you mentioning anything about the medication in your electronic health records. Okay, I hope that is pretty clear. And what Ellen said, also very important to discuss. What about whole conversation offering antispasmodic medication and the patient simply declined the medication? Now, this is a little bit nuanced. If you discuss the medication as a menu of choices, and you and the patient decide that you want to simply observe, expectant management, if you will. If that's what you decided, you and the patient decided, you did not recommend a medication. Patient chose to observe. The risk of observation is typically not moderate, which means it does not rise to a level 4 risk. However, if you wrote in your chart that we discussed treatment options and I strongly recommended or I recommended an antimuscarinic, then you can say, this is prescription drug management. You recommended the medication after you document after considering the patient's condition. I currently recommend medical therapy as the best course of treatment to achieve the desired outcome. If you write that down, then that is prescription drug management, even though the patient declined, and chose to go another route. Another example may be you recommended that the patient undergoes a surgery for urinary retention due to an enlarged prostate with a ball valving median lobe and compromised renal function because of BPH and ball valving median lobe. Yet the patient decided not to undergo the surgery and wishes to simply observe the situation. You recommended surgery based on the patient's condition. You documented all that. Yet the patient chose not to undergo surgery. Risk is intermediate or moderate. Doesn't matter what the patient decides to do, the risk is still moderate. Likewise, you recommended medical therapy, the patient chose not to have it. That is still a moderate risk. All right. Ellen also said, or stopping a medication for side effects. I think I've covered that pretty well. If you stop the medication due to untoward side effect, then that is also considered prescription drug management. Whether you write it, discontinue it, continue it, provide samples, that's all considered prescription drug management, provided that you documented, as I just mentioned, the necessary things that you need to include in your documentation. That is what constitutes medical decision making. It is very quick for us to think, okay, this is the condition, here are the treatment options, the patient has X, Y, and Z, not a surgical candidate, I'm going to go ahead and continue the patient on medication. It's very quick for us to consider this entire scenario and for us to prescribe the medication, renew the medication. It is very quick because we've done it so many times. However, it is imperative that you write it down in your EHR. Otherwise, it doesn't count. Sorry. Those are the rules. You want to play by the third-party payment scheme, you have to play by the rules. This is just one of the rules. Medical decision-making, risk section, moderate risk, level 4 risk. It's called prescription drug management. You have to document everything that goes on in your head within a fraction of a second. You have to write it down, or else it does not count as prescription drug management. And let's see, Ellen also mentioned the patient is on clean intermittent catheterization, but somehow was kept on tamsulosin or Flomax. Somebody forgot to discontinue tamsulosin. That still counts. You looked at the situation of the patient. Patient's bladder's probably, I'm assuming here, bladder's probably defunctionalized and is now self-catheterizing. Maybe he had urodynamics and is still unable to void due to a flaccid bladder. Now he is self-catheterizing. He's still taking tamsulosin for presumptive BPH. Somebody forgot to stop his prescription, or somebody told him to stop tamsulosin, and yet on follow-up, he is noted to continue to take tamsulosin, and now you discontinued the tamsulosin. That still counts as medical decision-making, prescription drug management, and it still counts as moderate risk because you are making a decision to discontinue this medication after looking at the patient's situation. And you would simply document, patient is status post urodynamics, found to have defunctionalized bladder, currently on intermittent catheterization, no further indication for tamsulosin, will discontinue medication. Done. Thought about the situation, you decided to discontinue the medication. That counts as level 4 risk, moderate risk in the risk section of medical decision making. Remember, You continue the medication, you discontinue the medication, you refill the medication, you provide a sample. That all counts as medical decision making. However, you have to document it as a provider, as a APP, MD, GO. You have to document that thought process. It is a pain in the butt, but without that documentation, no one can tell that you actually thought about this entire scenario and you decided to continue the medication. Maybe you want to take into account the AUA symptom score and you simply mention stable AUA symptom score while on alpha blocker, will continue alpha blocker. That's all you need, okay? Document it somehow that you've thought about the situation and you decided to continue the medication. Or you talked about other treatment options and you and the patient decide, okay, we will continue with the medication. That all counts as as prescription drug management, intermediate, moderate risk, level 4 risk in medical decision making, prescription drug management. Document it, document your thought process. Do not just refill your medication. Listing of the medication in your EHR is a single line without mentioning what you thought about the medication and your decision to continue on a medication. If you don't document your thought process, you don't get to count it. Your auditors are not going to know that you actually performed management of this prescription drug. So there you go. Any thoughts, comments, questions, or if you have a specific E&M topic that you want discussed, please leave it in the comments below. As always, I welcome any suggestions, agreements, disagreements, or additional sources of information regarding this topic. Please let me know. Leave them in the comments. Thank you, as always, for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.